a little girl who has battled the odds and won. So she's bringing awareness and hope.
The Allentown girl beat the odds, and now she's an
energetic preschooler who many consider to be a living miracle.
When Catherine was born, she was 1 pound 10 ounces and 12 inches long.
Catherine was a very small little baby. She was 24 weeks gestation. At that time, that was at the lower limit of viability.
They were telling me all kinds of things, that only 1% of babies are born this early, when less than 1% of them survive without consequences.
She had a lot of pulmonary issues, a lot of breathing issues. She had very severe lung disease of prematurity. Her lungs, at 24 weeks, your lungs are just not set up to breathe.
First few days, Dr. Zelinka told us it's going to be a roller coaster.
It was touch and go for about a week. We tried to intubate and extubate her several times. She was a strong little baby, and she came back every time.
She was in the NICU for 113 days from July 4th and then came home on October 27th. I knew that discharge day was coming soon. I left a book for the nurses or the doctors to just write little notes to Catherine that I could share with her when she got older. And in there are the greatest stories and notes from these amazing people who cared for her.
Dear Catherine, this is my official last scheduled night with you. It certainly has been memorable. My earliest memories of your color changes with weight checks and how your mom stood by your isolette and cheered you to recovery. It's very heartwarming to read them.
As we've grown, we've been able to create a pediatric health system, not just have a children's hospital. We're connecting not just through the usual traditional encounters and visits to the emergency room, but outside of those encounters, connecting with patients and families to ensure that we're optimizing their health and their health care as much as possible.
When I look back, absolutely the medical care was absolutely incredible, but they loved her and cared for her, and that to me at the end of the day are the biggest moments that I remember.
I think over the last couple years we've definitely seen growth in our surgical services, so we've been able to take care of more complex babies, which is what has allowed us to be a level 4 NICU for about 5 years or so now. And so the survival is much better, you know, and not only survival, but intact survival, or survival where babies are thriving, you know, like Catherine, where they're living life and enjoying life.
If I could say anything to those doctors and nurses that cared for me at the NICU, I would say thank you. Like, you are the reason that I am here today, and you're the reason that I am able to be a junior in college.
Well, as we grow bigger, we get better. We get better at what we do because we do more of it.
To this day, the only real outward sign that we see are some scars from IVs that are going to be with her forever, but at least those are her warrior scars.
I'm just very lucky that I had such amazing doctors and nurses that cared for me so fiercely and strongly, and I'm just very grateful for that.